guys, happy Sunday. It's your girl RC, the future OT. Okay, so today's video is going to focus on what is OT. What is occupational therapy? So I bet you guys, if I did a video and I went out in the community and asked people what occupational therapy is, probably 80% of the people wouldn't know what it is. So in this video, I'm going to explain what we do. What is it that OT does every day? So OT is also known as occupational therapy. And in occupational therapy, as occupational therapists, we can work in different settings. We work with different professions such as nurses, physical therapists, CNAs. So for occupational therapy, we can work in multiple different settings. So pediatrics, adults, older adults, school settings, hospitals, nursing homes, home health care settings, and a bunch of other varieties. So we're very flexible of who you work with and where we can work. And I do have an actual definition of occupational therapy, and basically we're the only profession that helps people across lifespan to do things they want to do through therapeutic use of daily activities. So let's give an example. Okay, so say we're gonna do an adult. So we're gonna do a female that is about 40 years old, goes down the stairs and something goes wrong and she ends up breaking her hip. Breaking her hip is a huge factor, and that is something that you don't want to do because it takes the longest to heal. As an occupational therapist, we would step in. What we would do is we would try to get her back to what she wants to do. So we focus on activities of daily living. So there are ADLs and there are IADLs. So ADLs are activities of daily living, and then IDLs are instrumental daily activities of living. ADLs concerning toileting, feeding, just things that you do on everyday, bathing, and then instrumental activities focus on things that aren't as important in a way on a certain level. So going to do soccer or doing sports, working out, going to the bank, going to church, and things like that. So in this case, boom, back to the female. She's 40 years old. She ends up breaking her hip. We'll ask her a bunch of questions concerning what she used to do before that tragedy happened. What is her prior level of functioning? How is she able to do things around the house now? Or just how is she able to go throughout her everyday life with a broken hip? Because I'm pretty sure she can't do anything. She just has to sit in bed and wait till professions come to her house. But that's besides the point. And what is her goal after she heals? So say her favorite thing to do is gardening. So what we would do is we would take steps or make activities that she can do prior to getting her back to her life choice or life activity of gardening. So some activities we could do would probably have to focus on, her legs, because that's what she needs. That's what she broke. So we would do little things like that. Like activities could be anything. We're very creative, so we can make use of things in the house. We also use a bunch of tools that can help too, such as a reacher, which is basically like a long stick that has a clamp on it that can get her to grab things around the house if she needs to use a wheelchair. With O2, we also focus on safety. So safety is a big precaution. So we would go inside the house and see what we have going on, what things we should move, if she has stairs, if she doesn't have stairs, and stuff like that. So we basically focus on a lot of things. We're the only profession, I feel like, that basically has or we can just change things around. We can be flexible and stuff like that. So I feel like with OTs, we're very different from physical therapists, because I feel like physical therapists, they have a routine that they have to do every single time they work with the patient. I feel like they're very repetitive. They ask the same questions they have to do the same exercises. It's very intense versus OT. We're fun, we're creative. Again, we get to work with the patient one-on-one, we get to do groups. So I feel like for OTs, we go in a couple different directions. We work with different professions, which I feel like is a plus, but I feel like we're also our own, and I feel like it's very important for other people to know that because they literally don't know what we do. Even for kids, we can go from the simplest thing to handwriting issues, working with their handwriting skills, their grip skills, and then we can go all the way to more important stuff like feeding them, not knowing how to feed properly, and getting them or trying to get them to do a goal of even putting their mouth properly on a straw. So I feel like it's very, very diverse in which ways we work, and I think I'm going to do another video and actually survey how many people know about occupational therapy, because I just feel like it's that profession that everybody thinks that it's either PT, physical therapist, or we're nursing, or they think we're CNA or aide, which, I mean, those professions are great, but at the end of the day, we're our own profession. So that's where I wanted to get in today, like a little quick video, and you know, just let me know if you have any comments or questions, and tune in for my next video. Bye, guys.